A trampoline park in Marysville closed today for cleaning after at least 12 kids came down with the norovirus. Now, we don't know for sure if they picked up the nasty bug at Altitude Trampoline Park, but we do know that they all attended a party there on Friday night. Now, the park was open yesterday, and we talked to some moms who were picking up their kids. They had no idea of this possible outbreak, and they weren't happy to hear about it.
Absolutely. I would not have dropped my daughter off if I would have known that.
And it's a drive to get here. There was no way I would have come for an hour. No, and especially knowing this.
So here's what the owner of the park told us prior to closing today.
We do a thorough cleaning every night, but they actually went through, after hearing about the reports of, people getting sick, they went through and did another thorough cleaning.
So a couple things to know about this virus. It's awful. It's very contagious. Anybody can get it. It's spread easily by people who have it, contaminated with food or water, or by touching a contaminated surface. According to the CDC, it leads to 400,000 emergency room visits each year, and we're mostly talking about kids. Dr. Ari Gilmore is here to walk us through some questions we know that many of you may have about this awful virus. I mean, it's just one of those that has a high ick factor, but it can also be extremely dangerous. So thank you.
Yeah,
let's walk through this. So the health department tells us they won't do inspections in the case like we are seeing at the trampoline park. So how hard is it to track the source of a stomach bug like this?
It's so common. There's those 400,000 people going to the ER, and there's 20 million other people getting sick each year. It changes each year, so there's new variants, so people don't develop immunity. So it's very difficult to track the individual person because it just goes around and around in the community.
So what happens when you get people coming in showing symptoms of this and they are positive for it? Do you pass that information along to the health department? Do other doctors' offices do that? How do we keep track?
Yeah, it goes through the lab testing and through Children's Hospital. Oftentimes they'll look at clusters, but generally it's more of a community-based situation where someone who's been told by their doctor that their children are sick will then tell the daycare, and the daycare should be taking extra precautions.
I've read that it's really hard to kill. So how can parents be confident in going back to a place where they know kids came out sick?
Most bathroom disinfectants or light bleach solution kills it pretty well. The problem is you don't realize you have it until you've been contagious for a few days, and people are often contagious for several days after they're sick. So it's just the spread factor before people realize they need to be careful.
Now, the moms in this case said, hey, our kids used hand sanitizer. Is that not enough to kill a bacteria like the norovirus?
It may kill it on your hand, but then if someone has reached their hand into the apples and the popcorn, and another kid reaches their hand in there a few minutes later, the hand sanitizer hasn't done much for them.
Yeah, so good soap and water sounds like a good trick to use.
Right.
When we talk about the flu or we talk about the mumps, we know that the health department tracks those. We also know those diseases can be deadly. Is the norovirus something we need to be that concerned about?
Right. It can be serious, and it's very hard on families, and kids will get so sick, and it's just difficult watching them throwing up over and over again. But only 400 to 800 kids die per year from it, with 20 million getting sick, so it's really not in the magnitude of the influenza virus.
How about treatment? Is there any way that we can minimize? I know it doesn't last very long, but you want to get to the end of it as soon as possible, minimize the symptoms.
Right, and that's really important. So mostly, like you said, we're talking about children, and they may not know better. They may throw up and feel better and then go for a meal, and then obviously that's coming right back out. So the real key is recognizing that they've got a stomach virus, moving into maintenance mode, which includes just literally 1 or 2 teaspoons every 5 to 10 minutes of a rehydration liquid, either a Pedialyte or a Gatorade that's been slightly diluted. And then if they're showing signs of lethargy, not acting like themselves, their mouth is getting dry, you get the gut sense that they're not right, take them in to see their physician. There's anti-nausea medicines that are safe for children in those cases to kind of get them along. And the last case scenario is obviously being admitted for IV fluids. Okay,
is norovirus seasonal? Is it something that we're going to see less of as we start to get into spring?
Generally, it's more of the winter months, the wet, cool climate when people are closer together. But we see our spikes here when all those cruise ships come into town for sure.
Yeah, that's when we always hear about it. These kids didn't have to go on a ship to get it. Dr. Gilmore, thank you. Important information tonight. And for you guys at home, the symptoms of the norovirus are just as you'd expect. They're awful, they're nasty, it's a bad stomach bug. So the important thing to remember is if you start to show any signs of dehydration, as Dr. Gilmore says, see your physician. That can include feeling dizzy, a dry mouth and throat, and a decrease in urination. We want everybody to be well, especially our kiddos.